thank you all for joining me today. Appreciate your being here. I want to take a moment just to reflect on the more than 6,000 Pennsylvanians who have died as a result of this virus. All of us have lost thousands of family members, their mentors, their friends, and it pains me even more that many could not even be with their ailing loved ones or adequately mourn because they were concerned for their safety. These losses and concerns show what we've been up against over these last few months. And I am proud of the people of Pennsylvania for doing their part to keep each other safe. That's what we've done. We've flattened the curve. We've protected our hospital systems, kept them from being overwhelmed by the crisis, by the pandemic. According to multiple studies, we've saved thousands of lives, even more livelihoods, by keeping people from getting sick. This was done with compassion. We were concerned for our neighbors. Now that we're past the peak, we've been steadily reopening while making sure that we keep workers and customers safe. The stay-at-home order has actually expired. Over half of the state is now in the green phase, with 12 more counties becoming green on Friday in just 2 days. And all the rest of the Commonwealth is in the yellow phase, where retail can open, restaurants can open. This is the yellow phase with their outdoor dining. Youth sports can begin. People can gather with each other, and we can resume much of our regular daily lives. We've done all this while driving down new case counts in Pennsylvania. Unlike many other states, last count I saw 19, that have seen cases spike during careless reopenings, Pennsylvania has reopened its economy while keeping people safe and healthy. We're requiring masks for employees and customers because multiple studies have shown that mask wearing actually reduces transmission of the virus. We're helping businesses implement protocols to prevent this illness from becoming widespread among their workers. And that's going to prevent supply chain breakdowns that can be caused by staffing shortages. We're building our testing and contact tracing capacity, and we're managing the outbreaks that do occur. I understand that it's frustrating. And I understand the hardships. And that's why on Monday I announced a grant program for small businesses harmed by the pandemic. But we have to stay focused on recovery, and that ultimately is what's going to help business. I ran a business, and I employed hundreds of people. And I know how difficult this has been for our businesses. A crisis calls on all of us to make the right decisions, even when they're hard. I'm going to continue to focus on protecting Pennsylvanians and navigating our recovery. But I'll tell you one thing, ending the disaster declaration is not part of that plan. It would not end the orders signed by Secretary of Health, Dr. Rachel Levine, under the Disease Prevention Act that include provisions for business reopening and worker and building safety. Let's talk about what ending that disaster declaration actually would do. It wouldn't reopen, first of all, a single business that was closed, and it wouldn't make anybody safer. But for everyone who has used telehealth facilitated by regulatory flexibilities during the crisis, it would end your doctor's ability to provide this service. The doctors, nurses, and other medical professionals who can practice because of licensing changes that we made during this pandemic, that would have to stop. They would have to go stop working. For the millions of people now receiving unemployment compensation, work search requirements and the 1-week waiting period would immediately go back into place. The PUC's moratorium on utility shutoffs would end immediately, leaving thousands of Pennsylvanians without water or electricity as we enter the hottest months of the year. The temporary eviction suspension would cease. The food distribution networks we've set up through our schools, they'd cease to exist. But, and this is important, ending the disaster declaration would not reopen anything. It just wouldn't. And anybody who says differently is wrong. I'm going to continue to focus on reopening and recovery and managing the crisis at hand to the best of my ability, with the goal of not being one of those 19 states that sees a spike in new cases. The reality is we are reopening, but we're doing it carefully, and we're doing it in a measured way to make sure that we're doing it safely. And we're doing it as quickly as we can. And we have a plan. For some, it's too cautious, and I get that. But for everyone who wants to move faster, there are other people who really understand why we need to do this in a measured way. We have to strike a balance. Meanwhile, the disaster declaration is in place. It stays in place. The choice we have is whether we prioritize safety by reopening carefully with precautions in place, or whether we just create chaos and confusion through carelessness. I'm standing for safety. I am standing for ordinary Pennsylvanians, and I'm standing for a just and a safe recovery. I'm standing with the millions of Pennsylvanians who have done the right thing to protect their neighbors throughout this pandemic. Thanks. Now I'd like to turn it over to Randy Patfield, the Director of Pennsylvania Emergency Management Agency. Randy.
Thank you, Governor. Good afternoon. I'm here today with the Governor to provide some context regarding a state proclamation of disaster emergency, what these proclamations mean, and how they're used to provide an effective and coordinated response to situations such as the COVID-19 crisis. Disaster declarations are used at all levels of government to facilitate response and recovery operations to human-caused disasters, natural disasters, or in the case of COVID-19, public health emergencies that require prompt and coordinated actions to save lives, limit impacts, protect citizens, and hasten really the personnel, business, and financial recovery of all those impacted. They provide specific authorities that otherwise would not exist daily, such as the ability to waive certain laws, as the Governor discussed, regulations and procedures that may be burdensome in light of an emergency in order to expedite aid that is critically needed during emergency situations. They are also used to provide specific authority to centrally command, control, and coordinate response and recovery operations, which provides for unity of effort across all agencies and jurisdictions that may be involved in the response. In the case of COVID-19, the response is slightly different than normal disasters and emergencies in the fact that the Department of Health is the lead state agency coordinating the public health portion of the response under the authorities afforded to the Secretary of Health under the Public Health Law. And PEMA serves as the supporting agency. However, there are a number of critical components of the response to COVID-19 that have required the authorities under the state disaster or under a state disaster declaration to effectively manage. Some examples where these authorities were or are currently being used include the ability to execute emergency purchase orders and other agreements needed for such things as personal protective equipment, such as N95 respirators for healthcare workers, gowns, and other pieces of critical personal protective equipment. Site agreements and equipment and supplies for alternate care sites and community-based testing sites. Contracts for direct medical care workers and other support personnel for long-term care facilities that have had issues maintaining adequate staffing ratios because of staff becoming infected with COVID-19. The waiving of licensing or reciprocity requirements through the Department of State for healthcare workers from outside the state to effectively function within the Commonwealth to assist long-term care facilities and other healthcare institutions during the COVID-19 response. Specifically today, we have personnel from Health and Human Services from outside of the state that are in the Commonwealth supporting long-term care facilities, and many of these providers come in from other states, and they need license reciprocity, and they need to be able to do that in a very short period of time so that they can effectively be deployed to assist those situations. Earlier in this response, we had additional federal support that was provided through the Department of Defense with medical personnel to be able to support hospitals in the Philadelphia area. These waivers were crucial to be able to get the medical personnel in place to be able to provide the needed support to those hospitals that were most adversely impacted. The ability to modify the scope of practice for specific medical practitioners to permit them to function in support of COVID-19 response operations, such as the National Guard, who are engaged in staffing community-based testing sites and providing direct medical care to long-term care facilities. State disaster declarations also give the authority to agencies such as ours to command, control, coordinate the greater response across all state agencies and leverage the physical and personnel resources from other state agencies to support counties and municipalities. To provide some examples, we have utilized incident management personnel from the Department of Conservation and Natural Resources to support the management of community-based testing sites, Department of General Services personnel have been used to be able to support the procurement of goods and services and build out the additional testing capacity across the state. Department of Human Services and Department of Agriculture personnel have been used to be able to support the mass feeding operations. And obviously the National Guard has been used to be able to support any one of a number of response operations during the COVID-19 emergency, anywhere from repatriation of the citizens of the Commonwealth from the Grand Princess cruise ship to providing long-term care facilities support to be able to support the mass feeding operations, mortuary affairs in the southeast counties that were adversely impacted, and general transportation support as well. All these operations require a high degree of coordination across not only state agencies involved, but all levels of government and other stakeholders. In absence of the authorities under a state disaster declaration, these complex operations would become increasingly more difficult to accomplish, would be less coordinated, and would take significantly longer to achieve, which in the case of the COVID-19 crisis would jeopardize the lives of those most vulnerable to the impacts of the crisis. And now we'll open it up for questions.
Yeah.
Okay.
For me or for Randy?
For Governor, for
Okay.
you. This is Sarah Simon with Spotlight PA. Governor, what will you do with the resolution? Will you veto it?
I'm not sure. I have the Office of the General Counsel Commonwealth is here just in case there's been, as I understand it right now, it's not going to get to my desk, which strikes me as a really, I don't want to step on your toes here, but since I'm not a lawyer, but the Constitution basically says when both chambers pass a law that is to become enshrined in law, it has to be signed by the governor. If it's vetoed by the governor, the General Assembly still has the ability to override that veto. But I know of no case, maybe I'm missing, so I'll let you speak into this, but I don't know anywhere in the Constitution that says a General Assembly can unilaterally pass a law and put it into place. Greg, you want to? No, we're going to take this to court. So, Greg, you might want to point that out.
Hi, good afternoon. To answer the question, we could veto the resolution if it would actually be properly presented to the governor. I think per the terms of the resolution, they plan to only deliver a copy to the Secretary of the Commonwealth. And so that is one of the issues that we're looking at, but it's clear, or it seems clear, that the plan was that they were never going to present this to the governor, thereby taking away his ability to approve or disapprove the resolution, which the Constitution requires that presentment.
Sorry, you said this was going to go to court, correct? So that would be at the taxpayer's expense, correct? How long could that legal fight last, and how long could it go on in the taxpayer's expense?
It's not clear how long such a litigation would go on. It's certainly not something that we take lightly, but I think in order to bring an end to the chaos and the confusion that has been created around the public messaging related to the concurrent resolution, that there doesn't seem to be any other option than to try to get a quick resolution from the court. And I think that any court hearing a challenge would recognize the need to deliver a prompt decision on such a dispute.
May I ask a follow-up?
Sure.
Today, Republicans said the message to business owners is to open back up. If a business does open up while this court battle is playing out, what kind of punishments could they face, or will that be in limbo as well?
I think the status quo is in place. As the governor has said, nothing has changed according to the phased reopening plan. The disaster proclamation remains in effect. Under the law, there's only one way to end it, and that is when the governor ends it. And as far as I know, he is not intending to end it.
What would you be taking to court if it's not going to get to the governor's desk? Could you just clarify the legal ramifications of this? Because as you know, the Republicans are saying something almost completely opposite of this.
Yeah, and I think you can understand my reluctance to get into a lot of specifics, but I think that there are a number of different things that we're looking at. It's obviously very unusual, and not that we've done exhaustive research, but it's not clear that this type of dispute has ever arisen, so we're looking at it very carefully.
If it won't reach the governor's desk, I mean, can we just continue on status quo, as you said, without addressing this any further? Is court necessary, I guess, is my question?
I think there is a desire to establish that the constitutional process is being followed.
I think one of the choices is just to ignore it, but I want to do the right thing, and I want to make sure that we, as clearly and unambiguously as possible, make the case that under our constitutional democracy, no branch of government, none, not the governor, not the General Assembly, not the courts, have the unilateral right to do anything, to impose their will on the people of Pennsylvania. This is unprecedented as far as I know. Do you have another?
I was just going to say, for the Republicans, obviously going to think that you're doing this unilaterally by not signing the end to this.
Let's keep in mind that we are a democracy, and democracies, like any other governments, go through crises. And so every democracy, as far as I know, every state, the federal government certainly gives the executive the emergency of powers to do the things that Randy and I outlined, to navigate our way through a crisis. Right now we're facing a crisis of pandemic, economic depression, we're facing civil unrest. I mean, all these things singly would reach the definition of a crisis. And in that crisis, how a government responds is really important, and what abilities you give in this democratic context to allow that government to function and respond quickly and efficiently and effectively to the needs of the people is really important. You take that away, you take away one of the things that sustains a government, especially a democracy. And I think I just don't know any explanation for any constitutional reason or grounding for what they're doing. Yeah.
Governor, who are Pennsylvanians supposed to listen to? You're saying, and the Secretary and General Counsel is listening to us, listen to us. General Assembly is saying, listen to us, we're lawmakers. And the courts haven't even been heard from yet. Who are Pennsylvanians on a daily basis supposed to listen to in this pandemic and in this crisis?
Me. The Constitution is pretty clear on this. But just to make sure, as I said, we're going to take it to the courts to make sure that there's not something that we're missing here. Maybe unbeknownst to me, somewhere embedded in the Constitution is the right of one branch to arbitrarily decide to do something that is at odds with the Constitution. I just don't know where that is. So I think the proper thing to do and the careful thing to do is to go to the courts and say, how can this happen?
Are you seeking immediate injunctive relief to keep everything in place?
Do you want to comment on that? I'm not sure what our legal strategy is, or you want to even talk about that?
Yeah, again, I'm reluctant to give specifics at this point in time, but that certainly, as you can assume, is something that we would be looking at. And I just want to follow up on the governor's comments to that prior question. And it goes back to a statement that he made in his remarks about the Secretary of Health's orders, and in terms of who should people listen to. Nothing in the resolution that was passed last evening does anything to disturb the orders that the Secretary has issued. And we've been very careful throughout the COVID-19 disaster emergency to issue parallel orders, stay at home, business closure, and then based on the additional and separate authority that is granted under the law to the Secretary of Health, she issued orders related to business safety, worker safety, building safety. Nothing has changed with respect to those. And the phased reopening is based not only on the actions that the governor has taken, but also the actions that the Secretary of Health has taken. So I think that we have the authority lined up from both of them.
What advice would you give to a business owner right now who is looking at this with some confusion? What does this mean for my restaurant? What does this mean for my operations?
Yeah, let me just make one final point. I mean, it's not me or the General Assembly, it's this virus. That's who the enemy is. And any time you try to distract from that, we're missing the whole point of this. We're trying to stay safe, and we're trying to stay safe from a virus that is bent on infecting as many people as it can. So to your question, businesses should do what they have been doing before, and that is try to keep their employees and their customers safe. Do what they can to avoid allowing that virus to infect them. And we are, and have had some success, a lot of success actually in doing that. We are not one of the 19 states that have seen a spike, an increase in the new rates. And I think almost all the states, if not all of them, have a disaster declaration. So we're not even out of the norm in that. Everybody else is doing this. So I'm not sure where this is coming from or why anybody feels this is something that we can arbitrarily just snap our finger and this virus goes away. It won't. It hasn't. It's still out there. It's still trying to infect Pennsylvanians. We need to do the right thing to make sure that we do everything we can to keep that from happening.
Republican lawmakers all along have acknowledged the fact that even playing by what they say the rules are, you could just issue another declaration tomorrow, or the day after they end the order. Why did you not just say, okay, play by your rules, but I'm issuing a new disaster declaration?
I'm not sure I understand the logic of that, but then that just says they could do exactly what they did too, again, right?
I guess to avoid a protracted legal fight, what would stop you from just being able to?
Well, I hope this isn't going to be a protracted legal fight. I think it's a fairly clear constitutional issue. Yes.
Governor, this question is for our statewide town hall tonight. As we look forward, how would you grade the state's response to the pandemic?
I think we've done pretty well. And again, I mentioned a couple studies. I know Drexel University did one focus on Philadelphia, and they said that what we did moving as quickly as we did saved 7,000 lives. I don't know where they came up with that number, but I think moving quickly, we certainly didn't see anywhere close to our health systems being overwhelmed. That's what we were trying to do in buying time. We were concerned about that. And it never got to that point. We never got to the point where we were out of the protective equipment, without the ventilators, the things that the health system needs to address this. We have had, on a per capita basis, we're the 5th largest state. I think we're 8 or 9 in terms of the per capita rate of, I don't know, is that cases or deaths? Both. So I think by any measure, we've done a good job. After the fact, we can all look back and point fingers at each other and figure out what we might have done better. But in relation to other states, we've done a pretty good job.
If I can just follow up with that, what would you do differently if there was a potential second wave of coronavirus cases?
Well, that's what we're working on. I know, Dr. Levine, you want to talk about that?
So as you were saying, we are concerned in public health circles about a potential significant increase in the number of cases in the fall. And so we are preparing every day for that. We are expanding testing, and we're continuing to expand testing. And we have some quite significant aspirational testing goals for the fall, hopefully using new tests that are very accurate and sensitive point-of-care tests that can be done really quickly. But even without those, we're going to be continuing to expand testing and also able to do some population-based surveillance testing. In addition, we are continuing to expand the personnel that will do the case investigations of all of those positive patients and then contact tracing. And the idea is to box in those cases, is that if we have positive cases through all of those different measures, isolation and appropriate quarantine, that we can box it in, prevent that from becoming significant outbreaks. And if we're able to do that on a wide enough platform throughout the state, working with all of our stakeholders, then that's how we're going to prepare for a potential increase in the virus in the fall.
Are you concerned about a potential spike, in the coming week, given the general sense of complacency and restlessness that we're seeing, the frustration that led to this right now, this coming out of the legislature, and also all of the protests, and obviously you can't social distance in a protest.
Mm-hmm. So we are being very watchful for that. Because of, for instance, people maybe being out over Memorial Day, or people in terms of the demonstrations that have occurred, we're being very careful and watchful about significant increases. We have not seen that statewide. We have seen some localized increases in a number of different counties, and we're working locally to box those in and to prevent it from spreading more widely, but we have not seen a statewide increase. As the governor has said, we're continuing to see decreases in terms of the number of new cases. We're continuing to see decreases in the number of deaths. And overall, for the statewide, the trend is good, but we're watching it throughout the state and county by county.
What are the local level increases that you described?
Well, we just talked last week about that Erie County had increases, and we're working with the state, with the health department in Erie County to try to box those in and prevent those from increasing.
Any other questions?
For the governor, regarding occupational regulations, specifically license reciprocity that you were talking about earlier, the Department of State spent a lot of time back in March working tediously to put these temporary restrictions and regulations in place. I'm wondering if all that work, the fact that it's tied to this specific emergency declaration, does that make you question the inflexibility of these occupational regulations in the first place?
Well, no. I think I questioned a lot of the regulations that were in place way before the pandemic hit, and the Department of State was working on looking at regulations in each of the businesses. This hasn't changed that. What this came about, what you're talking about, is because we wanted to bring, again, concern about the capacity of the healthcare system. We wanted to make sure that we had the capacity. So we were talking about bringing doctors who had retired back into service, nurses who would retire back into service. Well, if you're an active doctor or nurse or healthcare practitioner of any sort, there's licensing or certification requirements that you have to live up to. We relax those in order to encourage and entice people to come back. Those are the kinds of things that a disaster declaration allows you to do, because we were focused on buying time to make sure that we weren't overwhelming our healthcare system. I think in terms of, whether I think that we ought to be looking at our licensing requirements in general.
That's what I'm asking.
Absolutely. And as you recall, I started doing that a year and a half ago. So I will continue to do that. But this was focused on the COVID pandemic.
Right, no, I understand that. It was just, it was a lot of tedious work. If I'm not mistaken, Secretary Gofar has said that this process, to make sure that we had enough doctors in our hospitals, to loosen those regulations, made her, if I'm remembering correctly, kind of, reflect on why these regulations were so strict in the first place. Is that something that
and I don't want to, because I'm not sure what Kathy said, or Secretary Gofar said, but if we've learned some things on something that I think is really important, that we make sure that we don't over-regulate, and we learned something in this pandemic in that regard, more power to us, and we can learn that. So if she's already saying we've learned some things, then that's great.
And this may already be obvious, but with the Pennsylvania State Police and its enforcement issuing warnings and a few citations so far, will that continue even during this legal fight over the legislative action?
Yeah, nothing changes.
You mentioned that this puts in jeopardy possibly people being protected from eviction and having their utilities shut off. The GOP indicated today that they're willing to work on that with you.
That's why you have a disaster declaration. We don't want to work on things. We want to have them in place so that we can say with some certainty, somebody, we need you to shelter in place back when we did. And one of the things we're going to do to help you is we're going to protect you from eviction. We don't need to talk about it endlessly. We need to do something. And that's why democracies have these provisions that give the executive branch some authority. That's the constitutional reality that we labor under. I'm, again, very confused as to how the legislature thinks they can suspend our Constitution unilaterally.
So if a landlord would take action against someone right now and use the Republican-based proclamation as their excuse, is there any protection for someone who might get evicted at this point?
Yeah, the law. I mean,
I think, like the governor said, nothing changes. So if I were a homeowner or a renter, I would say this is still protecting me because the governor has not terminated the disaster proclamation yet. So all the protections that he's put in place are continuing until that actually happens. And essentially the resolution that was passed last evening is meaningless.